Play therapy is an intervention that we use with children because play is a natural expression for a child. Even if a child is verbal, it doesn't mean that they are necessarily able to put in words what they're thinking or what they're feeling. But with play, children feel very comfortable, they feel very safe, and we're able to actually help them explore their worries and their thinking. Play therapy is appropriate usually for children ages 3 to about 10 or 11. Books and art are also part of play, and we can use those forms of play therapy with preteens and teens, especially teenage girls. The parents are always informed about what's going on with the child. There are different kinds of play therapy, and one of the forms of play therapy actually involves active participation, always with the parent and the child. Essentially, there are 3 types of play therapy. There's directive play therapy, non-directive, and attachment-based. Now, directive play therapy is a form where we use games, we use books, we use art, or maybe a themed kind of workbook. And that kind of play therapy helps children to really develop strategies for coping with something like a divorce or death or anxiety. The non-directive play allows the child to explore their own solutions to a problem. They become the author or the script writer, and they do this through the use of doll houses or through puppets. And this kind of play therapy is most effective for if there's not a clearly defined problem, such as aggression or sadness, and we're not sure what exactly is going on. The third type of play therapy is attachment, and this is also known as developmental play therapy or theraplay. And the focus of this is actually the underlying disturbance between the caregiver and the child. The goal, therefore, is the enhancement of the child's self-esteem, the attachment, the joyful engagement, and the trust of the child, as well as to help empower the parents so that they can go out of the sessions with the things they've learned and use them at home. This kind of play always involves participation of the parents, and there are no toys involved with this interaction. The therapist will set an appointment with the parents and go through a full developmental history, and also find out what the parents think might be the problem. What is their perception of what's going on? Based on that information, the therapist will then suggest which type of play therapy is probably indicated.